PDMonitor is a medical device certified with a CE mark and soon with a CA in the UK that supports the continuous objective monitoring of Parkinson's disease patients and enables a paradigm shift in the management of the disease. A medical device is not a gadget. It has strenuous regulatory certifications. It follows specific rules in order to be able to be marketed because it is supposed to be used in clinical practice. So a key difference between commercial gadgets and the commercial medical devices is all the regulatory framework around the devices. PDMonitor monitors all motor symptoms of the disease except rigidity. So it also monitors gait impairment, postural instability, freezing of gait, and also it monitors left-to-right differences in the exacerbation of the symptomatology. This is very important because this disease being very tough to manage and you want all your artillery there, you want to have a full understanding of the phenotype of the patient, so it's important that this device can offer all this symptomatology depiction compared to others that cannot do that. The second difference has to do with the cloud infrastructure. So PDMonitor does not need to be back and forth to the base, to a hospital, and then like a halter sent back to the patient. It can stay at the patient's home for as long as needed so that you do continuous optimization, you can do habitual screening across time, and in this way combine both staging of the disease across time and treatment optimization when you see that there is a change. The data is kept for long. Based on GDPR, we keep the data for 10 years. So you have a powerful electronic patient record with all the trajectory of the patient's course in the disease through time, so you can compare with the past and also you can understand what has happened and possibly anticipate what could happen in the future. The mobile app is there in order to be able to capture the timing and type of medication, the timing and type of nutrition, but also the non-motor symptoms. And also it gives feedback to the patient about how well they're doing in a very simple graph, in a very simple statistic that, like a Fitbit, helps the patient know that they're doing better or worse and hopefully stimulate them to increase the efforts, wear the device, use the mobile app, and be self-managed. It enables the physicians to have a holistic view of the patient's progress in the disease. It supports treatment optimization because you can have a combination, a comparison between the treatment changes and the impact of those changes so that there is a self-virtuous loop between impact and causality. And also, because of the fact that the device stays at home, it helps the physician always know how the patient is doing and put the patient on a screening program in order to do continuous staging and treatment optimization of the patient.
The PD Monitor allows us to evaluate the patient's condition in a dynamic manner at home. And that really is a massive unmet need for us because the traditional model of care is based on clinic interviews, perhaps looking at diaries, clinical consultation, and is often fraught with inaccuracies because patients' observation when in the clinic might be very different to how they're at home. And diary-based assessments can also be erroneous because patients can fill up diaries retrospectively and there is a thing called recall bias. So the monitor allows us to look at what one of my colleagues, Professor Baz Bloom, has coined the term, the hidden sorrows of people with Parkinson. So it allows us to look at how their movements are at home, how their tremor is at home, how their mobility is at home, and allows us to adjust and optimize treatment accordingly. So I think the ability to do virtual care based on a triggered dashboard-based score is one of its greatest advantages. And of course, it then ticks the forthcoming strategy of the NHS to provide care, more community care, and home care in a remote-based model. It allows us to monitor people wearing these sensors at home. It gives us a dashboard of their symptoms, which I can access and the patient can access using a web-based, cloud-based system. It then allows us to monitor and initiate changes in therapy, both either pharmacological or non-pharmacological, to make improvements in these aspects, such as their mobility, such as dyskinesias, such as slowness, such as stiffness, and more importantly also gait, their movement, risk of falls, difficulty with initiation of gait, phrasing of gait, problems that we are often unable to address properly by simply history taking, and problems that, if not addressed properly, makes people socially isolated. And that then leads to a vicious cycle of generation of depression, of anxiety, of apathy, sleep disturbances, and some people even think it can lead to cognitive disturbances. So the wearable sensor-based care, which allows us to have a dashboard-based triggered treatment strategy, is therefore a great advance. The monitoring allows us to really evaluate the person at home. And that's critically important because the care that we provide for people with Parkinson is really based on whether or not the patient's condition is improving at home and thereby improving the quality of life, not just of the patient, but also the carer.